The significant aspect, and I'm just summarizing it, is that we're able to deliver universal health care through a strategy called mandatory health insurance. And this covers a whole charade of activities. And number two, becoming neutralizing outbound medical tourism. So we don't want any Lagosians to leave Lagos to obtain any form of healthcare abroad in Dubai, in London, South Africa, India. We want to be able to provide every kind of specialty and subspecialty to our citizens in Lagos. And in so doing, neutralizing outbound medical tourism and reversing it, in fact, and contributing to the GDP of Lagos, as happens in many parts of the world. Dubai, India, are realizing billions and billions of dollars in terms of medical tourism. And Lagos wants to participate in that. And we are, at the moment, in terms of the city that provides the best healthcare in Africa, we're now at number 8 after Cape Town, Johannesburg, Morocco, Egypt, Nairobi. Lagos is now number 8. And we're hoping that over the next 5-10 years, we can move up to at least somewhere in the top 3. So in the Lagos State Development Plan, over 30 years, we hope to achieve certain KPIs. You can see there that we're very concerned about nutrition. Why are we so concerned about nutrition in our children? Because to be able to be globally competitive, you need human capital. And human capital starts with the baby in the womb of the mother. And for the first 5 years of its life, if you do not give it appropriate nutrition, you're going to be developing a human capital that is substandard. And so, if we're going to be globally competitive, we must pay attention to human capital. And the most important aspect of human capital is safe motherhood, proper nutrition in mothers that are carrying their fetuses, good opportunity for delivery by skilled birth attendants, and then the appropriate nutrition for the first 5 years of life. We have a shortage of beds in Lagos. As you can see there, our estimate now is 50 per 10,000 population, and what we really want to achieve, according to WHO standards, is over 200. We're not so proud of our maternal mortality rate. It's the best in Nigeria, but it's not good enough for us. And we're hoping that over the next few decades, we can bring that number of 430 down to 140. Number of deaths in terms of children, we want to bring that down significantly. Here I'm talking about insurance over and over and over, because that really is the instrument through which we want to achieve healthcare financial reforms. We hope to be insured about 50% over the next 10 years. Then percentage of budget spent on health, currently at 8. The Abuja Declaration says 15%. I know that this government and its successor are going to try and achieve this target. So what is the theory of change for the Ministry of Health? We want to look at our health sector reform laws and review them, because some of them are a little bit outdated at the moment. Health and technology are changing so quickly that we need to be able to modernize, to be able to build modern health facilities for negotiation. We want to definitely increase our production of health workers and start a healthcare financing reform and look for the outputs, which means at least a 50% adoption of health insurance, achieving the target of 1 PHC, which is the bedrock of healthcare delivery, or what, and a clear referral pathway between the unorthodox community through the primary healthcare facilities, both public and private, up to secondary and tertiary. In so doing, we hope that we'll be able to achieve a reduction in these health industries that I just described. So the entire Ministry of Health is a very complex organogram. It's made up of several agencies that are doing a variety of roles and leadership and governance, our regulatory agencies, our hospitals and medical facilities, where we have at least 12,000 employees in our secondary, primary, and tertiary facilities. We have our boards that are responsible for primary health service commission last August, LASHMA, which sorts out our insurance, digital health, and our biosecurity council and incident command structure. And in the heartbeat of all that is the Ministry of Health with at least 10 directorates. And those directorates are increasing every year because we are diversifying in terms of what we can do in the health sector. Now, in terms of governance, I will bring to your attention that we recently achieved a monumental retreat only a week ago at the Lakaway Resort, where the Ministry of Health, the Primary Healthcare Board, and the local we all met for a 3-day retreat. What was the point of this retreat? The point of this retreat was to establish a common agreement, a formal performance-based agreement between the state government and its LGUs to clarify our roles, responsibilities, and expectations in the primary healthcare sector, aligning incentives with outcomes and establishing a set of mutually agreed accountability framework. So this was the group photo of the local government chairman and members of the Primary Healthcare Board and the Ministry of Health. It was an extremely successful retreat. The first time we actually had an opportunity to be locked away in a far location. Nobody could escape. We spent morning, afternoon, and nights together talking and networking. And at the end of the day, there is the chairman of Chairman Conference 57, Honorable Cheston Olowa, and the SA of my life, of what we were able to what was in that conference? There were citizens. First, the relation of roles between state and local government as far as coordination and agreed resources. 3, an agreement on what the primary healthcare platform is to deliver and to be able to provide to our citizens. A plan for human resources and centralized coordinating workforce. As you know, we're trying to digitalize the entire health space, and so we needed to have an agreement on the strategy in terms of the unified health information system. And of course, a progressive plan and strategy for improved health indices at our foundational platform, which is the health care, primary health care. Now, on the left is where we feel we are at the moment. It's slightly fragmented and slightly disorganized, which means that there will be slow progress. But I believe that after this compact with local governments, we can tell state and local government. It means that we are all expanded in the sector. So if we are organized in the government sector and the private sector, we are creating an enabling environment for the private sector. So the whole idea is that we become coordinated as the 3 tiers of government with rapid progress expansion and less dependency on the red dot. Harmonize our strategies, our dependency. So, human resources for health. What is the situation? We want to reduce brain drain and we want to increase brain gain. So, what is the strategy? Well, we need a healthcare financial reform. That's critical because it's all about money. We need to improve the working conditions of our healthcare professionals. We need to improve the living conditions of our professionals and facilitate the return of those that have already drained out of the country. We have a very huge diaspora in Europe, America, and all over the world, in the thousands. We don't mind because they're not wasting their time abroad. They're actually acquiring huge amounts of skills in specialties and subspecialties. And so we consider it that we're loaning them to the world. But when you loan, you expect that to be paid back. And what is the payback? The payback is that one day, if we improve the environment in which we work, all these externalized professionals will come back home where they belong. I graduated 4 times and I'm back. So it's not an unknown phenomenon. There's nothing wrong with going abroad to improve yourself as long as you can come back home. One of the key issues is around accommodation. And what we have done now in Lagos is trying to build staff accommodation of our major facilities. And any of our new facilities, we are definitely building accommodation moving forward. We've learned from the past. And as you can see from this picture, the hospital is in the background, and close to it will be adequate, comfortable staff accommodation. Right now, we're renovating the doctor's quarters in various hospitals. This is just an example of the Lagos Island General Hospital, where we're renovating the 10 floors of house officers, and this is happening across many of our general hospitals. Now, we need to increase our human resources. We know that, according to the WHO, we should have 1 doctor for 600 population. So that means for Lagos, we need about, for Nigeria, we need about 300,000 doctors, but we only have 40,000. So there's a shortfall of a larger number of. This is a huge number. And let me just say, for the record, that human resources for health shortage is a global phenomenon. It's not an Africa problem. It's not a Nigeria problem. It's not a Lagos problem. It is a global problem. It's a phenomenon. The problem is, however, that Europe and America are able to attract those that we produce abroad because they seemingly have a better environment to work in. But things are changing fast. Lagos is narrowing that greener grass on the other side. The grass in Lagos is getting very green, and in fact, we're beginning to experience doctors that are coming back. However, in the meantime, let me just highlight that many of our healthcare professionals are at high risk of experiencing burnout. Burnout is the phenomenon of excessive workload. So for every health professional we have in Lagos, they're doing the job of 10. So we need to be patient with our healthcare professionals. They're working under very hard conditions in terms of the numbers of people that they have to see on a day-to-day basis. In Europe and in other parts of the world, they're beginning to recruit robots. We haven't started that yet, and we're thinking about it. We might want to start building our robots in Nigeria. There's no reason why we can't do it. But however, for now, what the Lagos State government has decided to do, His Excellency has given us the approval to establish the standalone University of Medicine and Health Sciences. And this is in collaboration between the Ministry of Health, Ministry of Tertiary Education, the Attorney General, Ministry of Environment, and Physical Planning and Urban Development. And the strategy here is, typically we've been training our professionals in the green circle, which is our tertiary hospitals. But we that Lagos has in terms of general hospitals, PHCs, and in fact, private sector hospitals, military security facilities, and many diasporians abroad who want to participate in delivering healthcare to Lagosians. So what we're going to do is we're going to decentralize the training of our healthcare professionals from the green circle through the yellow to the red to the green, which means that we will have access to a very large number of patients. So for example, in our general hospitals, we see year in, year out about 7 million patients a year. And in our primary healthcare facilities, we see about 13 million. So when you add 7 to 13, you're talking about 20 million patients in the public health sector alone in Lagos. That is enough to train thousands and thousands of medical professionals, because medical professionals are like apprentices. They need patients to learn. Doctors and nurses learn by the bedside. They learn in the clinics. They learn in the theaters. And if you don't have patients, you can't make professionals. Well, Lagos has millions of patients, and so it's an asset for us that we must capitalize on to become the center of medical professional development in Africa. So what we plan to do over the next 5 years is to increase our intake of medical for nursing, for dentistry, pharmacy, by 500 heads. We hit a target of 2,500, which is about 2,000 more than we are doing at the moment. We've drafted the bill. It's gone to the Lagos State House of Assembly. It was passed by the Executive Council. This is the fastest bill that I have ever seen. In less than a year, it was passed by the Lagos House Assembly. And so we're just waiting for the signature of Mr. Governor, and this concept will begin. This is how we plan to distribute the training. We will concentrate on doctors, nurses, and dentists, and then there will be development of other capers that support the health sector. So you might ask, where are the professionals that are going to train all these increased number of students? Well, we have them, actually. If you look at Lasco, where we train at the moment, has 120 specialists. But if you look at our general hospitals alone, we have 250. So we have twice as many specialists in our general hospitals. And then we have our PHCs, our flagships. We have our senior registrars. We have our private sector, and we have the diaspora. So there are quite a number of potential academic professionals that can take on the responsibility of training professionals in Nigeria. So we've not just been sitting down waiting for the bill to have passed. In parallel, we've been carrying out in phase 1. There's going to be phase 2 and phase 3, but I'm only going to describe phase 1 to you. We've expanded 3 facilities in our asset of general hospitals. We've physically renovated 3 sites. And we've increased our student seating capacity from 300 to about 3,200. We're about to commission these facilities in the next few months. These are some of the sites. The Lasco multi-site conversion and the cardiorenal center have all been repurposed. The function of accommodating a number of students in phase 1 of this expansion, so that in the next 5 years, we will not be complaining about the shortage of human resources in Lagos. These are some of the sites that we've been working. Now, infrastructure is a very big issue for Mr. Governor, because our doctors always complain that our infrastructure is not fit for purpose, it's uncomfortable, it's many flaws in our infrastructure. And that's because many of them are old, many of them were not designed fit for purpose. And so we've developed what we call Mr. Governor's Blueprint for Medical Infrastructure Transformation. There are many assets to this. It's all about design, patient experience, maintenance, and energy, which were not incorporated into the facilities that we have at the moment. So we've built in sustainable concepts utilizing design technology from all over the world, collaborating with Lagos architects to develop what we describe as our green blueprint designs for the future of Lagos. We've looked at sunshine, we've looked at renewable ventilation and movement of the sun, and we've designed our new facilities over the past 4 years to be able to incorporate what we call sustainable renewable designs. And these are some of the attributes, including solar technology. Now, if you look at this chart, you will see that on the right is the average hospital that is not built with renewable configuration, and it costs us 158 million naira to power a non-renewable energy hospital, whereas our green hospitals, which are the future, the cost of powering those hospitals drops from 158 million to 61 million, which is a 96 million naira saving on energy. And as the cost of energy keeps rising, this is a significant development for us. Now, in the primary healthcare sector, we've developed 3 prototypes: the small, the medium, and the large. And here's the large. It's a very impressive structure. It took us 3 years to develop this design. It has an outer fenestrated sleeve with a roof, a false roof, and inside this fenestrated architecture is the PHC. And you can see there that our waiting rooms are not inside rooms, they're outside, so that we reduce the opportunity for infection transmission between people who are coming to access health. So our waiting rooms are in these outside corridors, although it's covered and protected from the environment, it protects our patients. And the roof is a very powerful solar panel. We can generally run these facilities off-grid unless there is prolonged overcast or rain, which resorts to our generators of the grid. Now, this is our first Lagos State green design prototype. From here, we're going to develop multiple facilities. And here's the first prototype of our general hospital design, and this is the Massey Children's Hospital. And we've started to develop this facility. This was about 3 years ago. You can see there on Osborne Road and Identity Adele Road, sandwiched between those 2 roads. This was when we were clearing the site, and this is what it looks like now. 10 floors of the most advanced children's specialist hospital in West Africa. We're hoping to be able to commission this facility before the end of this year. We're also working on Shomolu General Hospital. We're going to completely demolish the existing facility. And what we're doing here, we've reached foundation level. In the next few months, we're going to go up several floors, and hopefully we'll be able to complete this structure in the next year or 2. We're very proud of the Iba Ojo General Hospital. It's a big constituency hospital. Between Alimosho and Badagry General Hospitals, there were no major general hospitals. And so this fills a major void in that gap. It's a 280-bed general hospital. And as you can see there, that it's at a very advanced stage. The buildings nearest to you are all staff quarters, and the hospital is further away from you at the Iba Badagry Junction. This is then interested in is the Mental Health Institute. It's a mental health institute at Quebec. We went into virgin land about 4 years ago. We cleared the land, and this is what you see now. It's a very flat structure because for mental patients, you can't go higher than. So that's why we needed hectares of land to be able to build this facility. Now in Lagos, we know we have a lot of mental challenges by virtue of being a very complex megacity. But we're not planning to fill this facility with mental cases. We're planning to use this facility as an institute that is going to help us to design and plan a mental health strategy focusing on early prevention and early detection in community so that we are better equipped to deal with the stressors in Lagos. Now there are multiple infrastructures, a row of shops, main theaters, new dental center, the Imperial Suite building, pediatric oncology, high institute annex construction of new stroke building, proposed construction of office complex, and a host of other facilities. And if you go to Lasso now, it's one big construction site. It is That's because of the demand for specialist and subspecialist care for our citizens at our great tertiary institute. We're also building the first doctors' residence doctors' quarters at LASU. We've completed the foundation and we're about to erect the building. And the residence quarters is where our doctors who are learning to become specialists at LASU and all our general hospitals will be able to be accommodated comfortably so that they can focus on the job of learning their skills as specialists. Now we have about 3 more prototypes that we're working on. The General Hospital, which was to build like a general hospital. We won't do it in this dispensation, but we will design it and hand it over to the next dispensation. And just like we've done with successive governments, just like we did when we came into this dispensation, we carried on the unfinished projects of the last dispensation of Governor Ambody. The other prototype we're going to develop is the Lekki General Hospital. This again, the Lekki Peninsula is the fastest growing populated area of Lagos, and it doesn't have a major general hospital. So this is a very important strategy for us in that massively expanding industrial zone of Lagos. We also are developing a new prototype for mother and child centers. We have 11 at the moment. We want to have 1 in each local government. So we're hoping to be able to design as in the next 5 to 10 years, fill up the space across Lagos. Now, we've been talking about new buildings. What about our old buildings? We've been embarking on massive deep renovation across all our general hospitals. This is Lagos Island General Hospital. We've transformed this hospital from its colonial architectural to a modern design. We're also working in the solar, one of our very large general hospitals. We're also working, and you can see a transformation here. That's the canteen before and the canteen after, just to give you an idea of what we're doing. We've been working in Ebuteneta, we've been working in Harvey General Hospital. You can see a transformation going on here. We're also working in Nigeria. You can see us gutting the building. These are still live general. Very difficult for us to work in a very, very busy general hospital. Gutting the buildings, removing the windows, doors, pulling out all the toilets, bathrooms, sometimes taking off the roof, while we're still seeing patients in these facilities. This just gives an example of our interventions. Now, traditional medicine is a very big sector for us, and it includes all kinds of complementary medicine for orthodox practitioners. So we're very keen to develop a regulatory framework, a training institute. Here we can see some of our traditional medicine practitioners going through training and assurance and regulation of herbal products. Here we have 200 traditional birth attendants going through their graduation ceremony. And here they're going to be immersed in hospitals where they're going to improve their skill sets to be able to carry traditional birth attendant activity. We're working on a regulatory framework for the TBs to make sure that we consider them to be skilled birth attendants, able to create a referral pathway between the TBAs and our orthodox facilities so that they're not managing complicated cases. This is the old traditional medicine board. It's in Oniko. It's a very old colonial building, dilapidated and below water level. So anytime it rains, the whole place is flooded. What we've had to do is move the traditional medicine board out of this building to a rented facility. While we demolish that facility and start a new design. And this is the 3D prototype of the new proposed traditional medicine board headquarters, where they will be able to carry out training, quality assurance, and regulatory activity. Strengthening our primary healthcare system and governance in Lagos is extremely important as we consider the primary healthcare to be the bedrock of care. What Mr. Governor did was to strengthen the oversight by creating 6 districts within the primary healthcare platform. And in each district, there's to be oversight from an experienced administrator in the form of a PS. So there's 6 PSs governing the 6 districts of our decentralized primary healthcare. District 1, 2, 3, 4, and 5, and those are the areas that they cover. And in the primary healthcare, again, we've carried out significant deep renovations across 47 primary healthcare facilities. Those are some of the examples there. If you look through this list, we've also included additional renovations from the BACPF and from various, the Hope Foundation, and so on, the Hope project. And so we're really, really working very hard on the primary healthcare platform to transform it infrastructurally and make sure that it is something that we can be proud of. This is some of those sites that we've been working on. Now, the primary healthcare has the headquarters, and this is what it used to look like. Again, old, not fit for purpose based on our expanding population. So we demolished this, and this is what is happening there now. In the next 6 to 9 months, this beautiful edifice will be complete, and it will be the headquarters of the primary healthcare board, so that they can do the immense work that they have to do in terms of managing the primary foundation of our healthcare system. There are multiple healthcare achievements in the health district, from human resource development and capacity building, infrastructure development, innovation like data technology, community outreach and awareness, market outreach, and so on and so forth. This is where the rubber meets the road. And so our districts are extremely busy. Our permanent secretaries are working round the clock on the collection of cases that they oversight to make sure that we have improved indices. And here you can see some of the indices. We've been able to achieve 72% immunization coverage, 9 million children immunized, and 600 plus healthcare workers trained on electronic medical records. Now, the whole point of strengthening the primary healthcare, because prior to this, you can see the 3 tiers of healthcare delivery. In green is the primary healthcare, blue is the secondary, our general hospitals, and in red and yellow is our tertiary facilities. And what used to happen is that our citizens did not have much confidence bypass private hospitals. So what we're trying to do now is to build confidence in the PHCs, and we're beginning to see a return of our citizens accessing health and primary health, and refer patients, if need be, to the secondary. So we're decongesting the secondary and the tertiary strong primary health care. We want to give thanks to a number of donors that have been supporting the Lagos State government through CSR. This is construction of the doctor's quarters by Chevron in Bagada General Hospital. This building is actually complete now. We will commission it in the next month or 2. We also had custodian insurance give us an accident and emergency center at Egbe. You can see there the brown building is the custodian accident and emergency embedded in the Egbe General Hospital. And what we have here with these have donated several facilities to Lagos State government, a 60 hospital in Mission, a 80-bed diagnostic center, mortuary accident and emergency doctor's quarters at Animo Show, SDG donation at Imota, and an 80-bed ultra-modern facility in Ojota. And there we have a massive 200-bed multi-purpose medical facility with VIP suites donated by SDG to Lagos State government. and another one at Ipota. So we also have worked with federal government to establish medical stores that should be revamped, expanded, and increased in capacity, and that's complete. And we're now moving to some of the key service delivery achievements. We have a tighter and more efficient regulatory framework for the health sector. This is the role of EFAMA. What has happened in the last year, sealed 62 facilities for non-compliance. We've been able to total number of health facilities monitored between in 2025 was about 4,000. We've registered about 435 new facilities. And we have a total number of facilities within our pharma accreditation catalog of 4,735. Pharma have also carried out World Patient Safety Day. These are some of the pictures of that. In the Lagos State Ministry of Health, which is the nerve center of the health sector, we've got several directorates that are carrying out a multitude of activities, including policy guidelines and legislative development. These are the directorates: research, planning and statistics, health and economic unit, environmental and occupational safety, medical admin and training, family health and nutrition, nursing, staff clinic, epidemiology, Lagos State AIDS Control Agency, pre-hospital emergency services, ASAMOS, Directorate of Disease Control, Specialist Projects and Mental Health, Pharmaceutical Services, blood transfusion, and pharma. You can see that there's a lot of activity going on in the Ministry of Health. One of the things that we just did recently, I talked about increasing harsh environmental weather due to climate change. We're able to develop the Lagos State Health Adaptation Plan 2026 to 2030, a 4-year plan that is going to help us to strategically, according to a framework, develop a plan for adapting Lagos and mitigating against incumbent bad weather and extremes of climatic phenomena. So we've just launched this plan, and we've established a climate desk. And in that climate desk, we're going to be working to unpack this adaptation plan. It is in keeping with the federal government. We just domesticated the federal health adaptation plan to protect against climate extremes. We've developed the health sector annual operational plan. We've developed another policy called task shifting, task sharing, which is a very important document. Because of the shortage of human resources for health, we're having to create an environment where we can move some responsibilities and tasks from one cadre to another, so that our professionals are not exhausted and overwhelmed, while we're building on our health, human capital in the health sector. Now we need to harness public-private partnerships. Here we have an example of the public-private partnership in the Lagos Island General Hospital, called the Omotunde Ajoke Gold Hospital, where the private sector are going to transform this facility into a smart health. We're very proud of the Lagos State Comprehensive Cancer. It allows us just around the corner, most comprehensive cancer diagnostic center in West Africa. About to start the construction of this multi-billion naira public-private partnership joint venture. We also have the Medipark on Awolowo Road in Ikoyi. It used to be the old nursing home. It's at number 1 to 9 Awolowo Road, a 140-bed PPP, creating 1,000 jobs and costing about $60 million US. This is a PPP with Iwosan Group of development. This is the bare site of the where we performed the groundbreaking last end of 2020. add another multidisciplinary health facility to our facilities. These are the kinds of things that are going to reverse. We have seen a phenomenon called medical industry and innovation. This is going to be situated at the Lekki Free Zone. Those of you that don't know about this Lekki Free Zone, it's in where the refinery, and there's going to be the second Lagos State Airport. We already have the second deep sea port there, which is functional. The new airport will commence construction soon, and we've been allocated space in the Lekki Free Trade Zone. What are we going to be doing here? We're going to be doing all kinds of things that allow Lagos to protect itself from shocks. So what we experienced during COVID, where we ran out of consumables, the market forces and the demand forced the cost of syringes, nose masks, and all kinds of things went skyrocket in terms of cost. So if we're able to produce our drugs, our consumables in the Lekki Free Zone, we do our own research into conditions that are prevalent in Lagos, and we are able to find domestic solutions for our domestic problems. This is a very major project. Mr. Governor has given his approval. We've started the feasibility study. We've been allocated the land, and we're doing it in collaboration with the Ministry of Commerce, Cooperatives, Trade and Investments. And we already have a whole list of international and local industrialists that are queuing up to participate in the development of the last project, which are making Lagos State less dependent on importation and being able to produce its own consumables and more for export, thereby contributing to the GDP growth of Lagos State. This together, smart health information sharing is designed to digitalize the entire health sector, starting with phase one, the public sector, and eventually through policy guidelines and legislation, we'll be able to move into the private sector. As government, we want to know what the health-seeking behavior of our citizens are. The only way to do that is to have this data collected, and the only way that's going to happen is to digitalize. So this is ongoing. In the digital health unit, we've been able to establish a framework for the digitalization process. And what's going to happen, this will be like a dashboard. We're going to digitalize the primary healthcare board, the Health Service Commission, our biosecurity applications, all our essential medicine agencies, regulatory agencies, and all our facilities, including the Ministry of Health, so that all activity within the health sector is captured in a digital framework. We're working with the Ministry of Science and Tech because our data reservoir is going to be hosted by them, and we've about reached 30 to 40% completion of this process, whereby all our facilities are interconnected. What's going to happen is that there will be speed of access to care. If you are moving from one hospital to another because you are being referred, you will not need to carry files with you. You just have an access number, a unique access number. You just present yourself at the new hospital or a pharmacy or a laboratory, and your details, which are secure, can be pulled up so that your care, continuum of care, can be expedited. It will cut several leakages. There can even be communication between ambulances and hospitals. So when you pick up the patient, gone are the days where you'll be driving around looking for a bed. You just need to go into your computer, describe your patient, and the ship will tell you exactly where to take your patient in the interest of time and life saving moments. So we have a lot of programs in Lagos: malaria, TB, HIV, metabolic disease, hypertension, diabetes. But we're very proud of the malaria elimination strategy. And I'm just going to describe that for a few moments. The mission of Lagos is to drive malaria prevalence down to pre-elimination and make malaria free. So what is Lagos State's strategy against malaria? Over the past 15 years, our rollback malaria strategies have been working. In 2010, 15 out of every 100 Lagosians were positive for malaria by prevalence studies. In 2015, that number went down to 10, and in 2025, that number went down to between 2 and 3, which is an indication of the success of our rollback malaria programs in Lagos. Now, for a mosquito to transmit malaria, it needs to bite somebody that is red, that is positive for malaria, and be able to give it to somebody that is gray. So if you continue to reduce the number of people that are carrying the parasite, it becomes harder and harder for this female anopheles to find a positive patient, bite that patient, and give it to someone else. So in the past, in blue is what I just described. We've been increasing our prevalence of malaria parasites in the community from 15 to 10. But yet, in community, we're still diagnosing high numbers of malaria. And as you can see here, Mr. Governor examining this data with us and said there's something wrong here. And so we decided to use some of our resources to put together a very powerful team of the WHO, the Nigerian Malaria Elimination Program, the Pharmacy Council of Nigeria, one of our partners, to once and for all establish the true burden of malaria in Lagos. And here is the proof. The first thing we did was to compare the diagnostic tools that we have. So we have microscopes, we have rapid diagnostic tests, and we have PCR. PCR, if you recall, is what we used during COVID. It's a very, very accurate diagnosis. If you take a sample and you put it through a PCR machine, if you have malaria, it will find it 100% of the time. And so we compare the rapid diagnostic test, that little cartridge there, to expert microscopy and PCR, and we found that the rapid test is 98% sensitive and specific by a very robust research strategy that we deployed in Lagos. So this little rapid diagnostic test is very easy to deploy in the community. And so we put the microscopes aside and we use this rapid diagnostic test. This is how it works. You take a little finger prick and you put that blood into the cartridge and you put in some drops of the buffer, and within 10 minutes you have your diagnosis. That's a negative result with one bar, and there is a one red bar is negative, two red. Incidentally, yesterday I stopped the pharmacy on my way home. And when I got to my phone, the test red bar, which means it is negative. I'm testing. So I was reassured. I just took 2 Panadols. There I am. Otherwise, I might have thought I had malaria, like many of you do. Small headache, body pain, fever, feeling cold, you run for anti-malaria. So we used this rapid diagnostic test and we went into the community, both the community pharmacies, the PPLBs, and the primary healthcare facilities. And we conducted what is now recognized to be the most robust malaria research ever conducted in Nigeria. We tested 78,000 people with fever across 514 facilities. 390 of those facilities were community pharmacies and 122 were primary healthcare. What? Very low incidence of malaria. It was very low in the dry season, and as the rains start with the red arrow there, it went up to 5-6%, and it started coming down again, and it has come down in the dry season. So what does this mean? When we now informed our primary healthcare facilities, our general hospitals, that don't treat any symptom of fever until you test for malaria. That's 60% crashed to 5%. So it means that all the people who thought they had malaria, 95% of them did not have malaria. Only 5% have malaria. So in red, we now classify those as malaria negative fever. It is the key to find out what is causing the malaria negative fever. It can be a myriad of things, from bacteria to viruses to other parasites, including malaria and fungal infections. And so when you go and see a healthcare provider, always insist, if you have a fever, insist that you get a test. It takes 10 minutes. It's very easy to do, and it can save you from unnecessary treatment. And it then helps the healthcare provider to focus on finding out what is causing your fever. If you get treated with an anti-malaria when you don't have malaria, not only are you wasting money, you're driving resistance against the drug, and you're exposing yourself to a complex combination of drugs that can on occasion be harmful. It is also delaying the real diagnosis. So by in Lagos State of no treatment without a test, about achieved about 4 things. We've saved anti-malarials and stopping what we call sledgehammer to a doctor or a pharmacy and complain of fever, body pain, headache, bitter taste in your mouth, and you walk out with about 4 or 5 drugs. Unnecessary, harmful to you and harmful to the environment. We are now preventing by doing testing before you treat. You prevent the delay in identifying the real cause of your fever, which can be life-saving, because if you take the drug for 3-4 days and you're not still better, that's 4 days wasted. Not only that, many of you will be complaining that this anti-malaria drug is not working. It's not working because it's a medicine for nothing. Aiming at reducing what's a very dangerous phenomenon called AMR. AMR stands for antimicrobial resistance. What does that mean? By the unnecessary use of antibiotics, antimicrobials, and anti-TB, and if you use it in the wrong way, you are generating antimicrobial resistance, which means that when you actually need to use it, a very robust biosecurity framework. What we used after Ebola, we built the Lagos State Biobank in the infectious disease hospital to navigate the COVID outbreak response. It was extremely effective. But what did we realize during COVID? We realized that what we thought was a big facility actually turned out to be too small. And so we've started to design the Infectious Disease Research Institute, which will be built at the mainland hospital. It's a much larger facility. We know that in Lagos, we have to have our surveillance up to par at all times because we have a very active influx of people and animals. We have the largest airport in Nigeria. We have the largest seaport. We have several borders both across states. We have almost 8,000 animals coming into Lagos. There's a high risk of a biological shock happening in Lagos. And so inside the mainland hospital, we've designed the Infectious Disease Research Institute. We've cleared the land and we've set up, done the land preparation. We've done the groundbreaking. The designs are almost complete. And hopefully, before the end of this year, we will start the construction of the Lagos State Infectious Disease Research Institute, which is going to be the center of our biosecurity protection strategy against shockwaves that may affect us. Biosecurity is everybody's business, and it is indeed very serious concern for us in Lagos. Our health financing reform is increasing the pool of funds available to pay for health. We are localizing the National Health Insurance Authority Act to enforce mandatory nature of health insurance in Lagos. There is a gap between what is available to us through our budget and what we ideally want to spend. The blue bar is our current budget, and the red bar is our wish budget. And you can see that there's a gap of about at least 100 billion between what we get and what we want. And so we must fill that gap with an alternative source of funding. Nowadays, we can encourage the government and fight for increased budget allocation. We can continue to romance our donors and get additional funding, but you all know that donor funding is drying up. So the answer for us really is two things: health insurance and public-private partnership. And this is where we are focused on at the moment. Let's talk about health insurance. Health insurance is important. It is the umbrella by which the healthy look after the sick, the rich look after the poor. It is a solidarity phenomenon. And the more people that are under health insurance means the more people we can look after, because there will be huge amount of resources flowing into the health sector. So this is the reason why Lagos State, His Excellency, in his wisdom, domesticated the NHIA Act of 2022 in the 16th of July 2024. We domesticated it through the executive order. And this executive order now states that every Lagosian, if you live in Lagos, you are now mandated to carry some form of health insurance. These are the details of the executive order. We are to carry out a massive public health awareness campaign. We are to partner with the private sector to align the public and private insurance for better access and convenience of our citizens, and incorporate a solidarity fund there so that the rich are looking after the poor. We are supposed to enforce this executive order through a multi-ministerial task force. All that has all started. If you haven't noticed, it's happening. Resources will be set aside to stabilize life-threatening emergencies. Additional resources will be diverted to supply side, particularly PHCs, to strengthen our platform of public health insurance. And then we have obviously a large number of vulnerable citizens in Lagos who are being looked after by the equity fund, and the executive order provides additional funding for supporting the vulnerable members of our community. So Lagos State agency, Lagos State Health Management Agency, is the driver of this strategy, making it possible for all Lagosians to understand the importance of health insurance, creating the partnership between private and public sector, and creating debate towards public awareness, supplies, government, administration, research. Again, in the last 5 years, this is their data. What they've been able to do is increase their enrollment since 2025 to date, now about 1.46 million lives. Significant, but there's a long way to go. What is the role of health insurance in the private? So if you can see from this table that in Nigeria, we spend 33 trillion naira on health-seeking behavior. Unfortunately, 77% of that comes from your pocket, and only 2% comes from insurance. This is an anomalous relationship. It should be the other way around. 77% of people should be relying on health insurance to purchase health, and less from your pocket. So this is what the executive order is. Now, the private sector has grown to 50% of the private manpower and patronage. The chairman of private medical practitioners is trying to appeal to government, since they provide a significant amount of care to the population, that we should be sensitive to their struggles. And so we are. And because of that, we're driving this enforcement of the executive order across both public and private sector. This is the enforcement strategy of the executive order. A law that does not have enforcement is just a piece of paper. So in this enforcement, we're just explaining how we're going to encourage Lagosians to take up insurance according to the law. All ministries, departments, and agencies are hereby directed to ensure that all residents seeking access to their services will show evidence of some form of accredited health insurance. All MPs are directed to request proof of social health insurance, either from NASHA or from Lagos appointed health insurance providers seeking access to their services. All residents of Lagos who do not possess a valid social health insurance will be required to register. Now, you can see from this graph that the enrollment between 2016 and 2025 has been a gradual inclination. What we hope to see is that from this year onwards, with the enforcement, we're going to see an exponential increase in enrollment of Lagosians in health insurance. And this is going to really transform the healthcare both in the public and in the private, creating a virtuous cycle, because the more people that are insured with insurance, there's more money in the system for facilities equipped, and infrastructure will, and this will continue to be a virtuous cycle. This is Lagos. You see, it's made up of kinds of people: green, blue, red, yellow, purple. There are rich people, not so rich people. There are sick people. There are well people. But we are one people, and we need to look after each other. And that's the whole point of insurance. Under insurance, the rich look after the poor, well look after the sick, and everybody gets an improvement in their well-being. Now, in the private sector, as I said, we're not just the government of the public sector. We need to be very sensitive to what's happening in the private sector. We have a number of very good success stories in the private sector because the Lagos State government is enabling the environment. And particularly with this domestication of health insurance, the private sectors are in a position now to improve their sustainability. So that's the doctors, this is Evercare, and this is the Master Route. Every month there's a new multidisciplinary facility popping up in the private sector. We're not competing, we're very, very happy. We want the private sector to boom. We want Lagos to be the center of medical tourism for West Africa and sub-Saharan. So His Excellency and the Ministry of Health are very excited with the development in the private sector. And this is as a result of government policy guidelines and frameworks. On that note, I'd like to thank you for your attention.
Hello. Distinguished ladies and gentlemen, I think the Honourable Commissioner and the state deserve another round of applause. No wonder the Honourable Commissioner was described as heavy. And I'm sure not only the Honourable, but to the SA and all the health family, Lagosians must say and be grateful for all this that you're doing to ensure that you collaborate with Mr. Governor to ensure that Lagosians are in good hands, particularly in terms of their health, and to ensure what we see in all the commissioners read that Lagos State is doing great, and it's not even related to ensuring that the well-being of the Lagosians remain paramount in the heart of Mr. Governor and his deputy. And that's why the other commissioner and team are doing very, very well. I must say that I'm really overwhelmed with this record that the other commissioner and his team has presented. Once again, please, let's all put hands together for the other. And also for the special advisor doing. On this note, distinguished colleagues from the press, I'm sure we must have one or two questions to ask from what the commissioner has presented. So, gentlemen of the press, the floor is now open.
Good morning, sir. My name is Adiola. I report for West Campus. Thank you, sir, for that. Private schools. Please ask the second question.
Good morning, sir. My name is William Salam, and I write for Italian. Thank you for the insights you provided about the activities of your ministry in the last one. You said 4% of it have health insurance. And while you were speaking before that, you said about 1.4 million residents have registered with the states. If we go to that 4%, then they are getting the data from in terms of you provide that provided by the state government. What is the data that 4% from the private sector that maybe 4%? Another question I would like to ask is about traditional medicine. I want to thank you for saying that the state government is working on providing some training for the practitioners. But if you look around our communities, people you could term as charlatans are probably the major player in that sector. And it is having huge health implications. On my dad died of prostate cancer. One of the issues he had was because he had his kidney. Well, before they got to that stage, one of the doctors will be too careless and said something like that. Maybe he has been taking and this is my dad was a pastor, so he was not somebody who was so. But I just tell you the trend that because I think I questioned the doctor and he said, "Oh, that's been general. Majority of those who have that is because they've been taking herbal medicine." So I just want to know what the state government is doing in concrete terms to ensure that there's some sanity in that sector. Because rather than having a pushback, it's like was like last week. You also talked about the basic vision fund. You talked about the state government innovating eight facilities, I think PACs. But I know the federal government, through that fund, provide funding for consumables. Can you provide the PACs that got the consumables, and if those drugs were provided in line with the federal government sector? Thank you.
We now invite the Honorable Commissioner for Health to answer the questions. You have the floor, sir.
Yes, thank you very much. I think it's Adi from the Western Post. Yes, we're all watching the scenario around the virus. I want to say, first of all, this virus is a virus that has been from one person to another. It is not that contagious, although it might be mutating in such from one getting easier for the virus. So we're just watching the literature, we're looking at the research. For us in Lagos, we have what we call a biosecurity shield. We work very closely with the airport, port authority, health port authority, and the borders. And whenever somebody comes in that has a suspected illness, it is picked up at the airport, and we are able to interrogate what's going on there and identify the situation. For if the patient manages to get into community and present to one of our facilities, if they're presenting with the features, now that we're aware of antivirus, we'll be looking at published CDC it's right now framework. Just like we did for COVID, we are on the lookout. We are always very, very astutely aware of what is going on around us, and we hope that it won't come to Lagos or to Nigeria. If it does, that we will pick it up early, and this virus still remains in its wild form, which is that it is very, very difficult to be transmitted from one person to another unless you've been in very close proximity to a positive patient for a long time, which is what has happened on this ship, because people have been sleeping in the same cabin. A ship is not a very big place. You spend time very close to each other, and they were able to transmit it from one person to a few others. In all our hospitals, in all our schools, we are trying to establish sick bay Ministerial basic education and tertiary education. So both in the primary, secondary, and our tertiary institutions, we are trying to develop healthcare so that our students, our learning are able to access as ongoing with every year we establish these facilities within the schools. To Bengas Talau from the Guardian, thank you very much. Our insurance data is, you saw from the records that Lashma is recording about 1.4 cumulative lives. At any one time, every year, some people add on and some people drop off. And that's in the public sector. I'm not sure in the private sector. But we're not so sure about the number, which is why we don't want to create a narrative. We've established the executive order in the Lagos State. That detail is a little bit more clear. Whatever the case may be, both public and private is probably as public. Really, we want 50% and above. Regarding the traditional medicine board, that is why we are doing what we are doing. In fact, Lagos State, I believe, is the only state that has such an aggressive regulatory framework in terms of a whole agency that is dedicated to the regulatory function of traditional medicine practitioners, including training and research about agro and all these. Yes, I agree with you. Many of them are charlatans because they are not registered, they are not accredited, they are moving in and out of the state, carrying these concoctions with them. Whenever we find them, we're able to apprehend them because the traditional medicine board gives a seal of accreditation to anybody that has gone through the appropriate training and they are able to identify the herbal combinations that they're using to ensure that these herbs are not the toxic herbs that can have effects on our organs like described. It is common practice across Nigeria and Africa for these concoctions to be consumed. And no doubt they do have some toxicity. And that is why we have established the traditional medicine board. That's why we're very eager for them to have their headquarters. They also have some satellite stations, they grow their own herbs, and we're able to do appropriate evidence-based research on the drugs that they're marketing. And they have to have NASDAQ qualification, NASDAQ serial number. So if you're buying anything that does not have a NASDAQ number or an accreditation from traditional medicine, then you're putting yourself at harm. This is an important opportunity for us to educate regulations. Please do not purchase from anybody hawking concoctions. See that they are properly packaged, check that they have a NASDAQ number or at least an accreditation serial stamp from the traditional medicine board. And if they're practicing in a location, they should have a certificate hanging on the wall that distinguishes them as having been trained and accredited. And her farmer are also working with them. And we are able to penetrate into the deep communities wherever we can stop these abnormal drugs, some drugs that can be harmful to us. I'd like to ask the Permanent Secretary from the Primary Health Care Board, Dr. Mustafa, to answer the question around the BACPF distribution.
Thank you very much, AC and Special Advisor. The federal government reaches out to states in terms of improving primary health care services through the Basic Healthcare Provision Fund. Now, this Basic Healthcare Provision Fund has several layers. One of the layers is the National Primary Health Care Development Agency pathway. You have three other pathways. Now, the ones coming to the National Primary Health Care Development Agency is directly sent to the states through the State Primary Health Care Development Agency or boards. Now, these funds have stringent criteria for you to access the funds. And then consumables. You're expected to spend these funds on improving services at the primary health care level, and especially directly at the primary health care centers. These funds will be used for consumables, it will be used for human resource of health, it will also be used for infrastructure. Some levels of innovations have been carried out through the basic healthcare provision as alluded to by the Commissioner in his presentation. So these funds, like I said, has stringent criteria for health centers that have been so empaneled to assess. Now, right now, not all of our primary health care centers have been panel assessing this fund. They are not criteria, have been given the fund and they are making use of the fund. Now, basic healthcare provisions fund was initially not enough for the primary healthcare facilities. So, with the improvement in basic healthcare provisions fund, what has been referred to as BHCPF 2.0, what is coming to the primary healthcare centers in terms of direct facilities funding have improved to an average of 600,000 to 800,000 per quarter for the primary healthcare centers, and this is being given to primary care facilities that have been so empaneled, and they are making use of it. And as they do so, they also will be expected to retire these funds and will be audited. And we have also had improvement in the number that are having fund in the state. But this is still not enough, and we expect that come the next distribution cycle, we'll have benefit from the basic healthcare provision fund. Thank you.
We have one more question for the Honorable Commissioner.
Honorable Commissioner, my name is Lukman Baruch. I work for Voice from Nigeria, UN. I'd like to thank you so much for your what I call helpful insights into some of our songs that you have just today. And my question I'm directed to Esty. I'm directing my question to Esty is about a farmer. As you all know, a farmer has been doing, in the past years, the health sector in Lagos State, trying to regulate, the space. However, to improve a supervisory role. So, more what's doing, about this. Thank you.
Okay, so we invite the Estate to.
Yeah, sorry. Thank you so much, Can you just elaborate when you say supervising a farmer or a farmer's role in supervising a person? Can you just?
Yes. A farmer role in, yes, a farmer role is supervising.
So one of the things was that I was saying that we all know, the role that the business is playing. So what can we do? What is in place to ensure that we enhance the supervisory role of that agency?
Okay. As you all know, what we do is to be different. Farmer will now have jobs when people are taking over just about a month ago. So a farmer is a critical agency when it comes to patient safety. I'm sure you all know that. And we're we're actually the first state to have such an agency. And there are only 3 other states that have joined. And guess what? We all came here to find out what we're doing. So my commissioner said Lagos is growing. I mean, we're overpopulated. We have a lot of factory going on. We have a lot of hospitals just being open. Even the agency cannot keep up with the number of hospitals and facilities that are on. So what we're doing as a government, because strongly believe in a farmer. As you all know, patient safety is actually now a national priority. I am actually a member of the National Task Force on Clinical Governance and Patient Safety. I also, the federal government is also trying to get an agency like the farmer. They're actually working on it. So what we're doing in terms of actually ensuring that the farmer stays on course and all is that we've got, how do I put this? We've got other people, we've got other franchises, that's the word. We've got doctors, nurses that are helping the capacity of the agency. Because like I said, every single day, not only do we actually regulate and ensure and give licenses, we also get complaints here and there. So it's a lot of work, and it's not something that we just go in and then that's it. There's a lot of work to it. So what I'm saying is that we also need the support of everybody here. In terms of when you see something, let us know. Say, let us know here, this is what they do. There are standards. Every single that is farmer has a standard. And so it's our job to ensure that we shut them down until they get back to that standard. And that's what we do day in, day out. And I can tell you on average, and I would like Dr. Ebujobi to also say something, since you just taken over. On average, I get about maybe 10 facilities. We've got cosmetic, spas, and all that apply us to license them. So it takes a while for us to go there. So we are short-staffed, extremely short-staffed, and we're using people who have been tired, who have experience, we're bringing them in, and different franchises are coming, we're training them on what to look out for. We've made things easier electronically for people to actually register. We're encouraging registration. So please, I will say this. If you do not see the sign of a farmer saying we have accredited, don't use it. As we can tell you, if you feel if there's one that has the sign, so we rely on job, give a good job so that you can meet her and she can tell you what she wants.
Good afternoon. So as Hesley has said, our job is to monitor and regulate. And we want to assure the citizens that what we like to do is to ensure that any facility, your clinic, your hospital, your lab, your spa, medical spa, you function according to standards. Now we develop these standards, and in developing the standards, we work with the providers so they understand what it is they're supposed to do, to understand what their limitations are, not go beyond what they're supposed to do. And so as a team, we go out for monitoring. And because, like Essie has said, we don't have everybody we require, we've engaged the franchise companies, there are 8 of them. So they work on behalf of the farmer. They go into the years we expect at least a year, and 50% twice a year. And so we go out standards, your healthcare, and we have regular lessons to practice for the current year. And so that's what we do. And you're going to a facility and convalescent. Now that facility isn't authorized to do that. So in that kind of place, we believe that that is quackery. And so we have to shut them down and do the necessary investigations. You find some facilities where they have expired drugs. The people on the road have trusted the government to ensure that any facility they walk into, they guarantee quality of care and patient safety. So those are the kind of things we work. But we're also working with the stations. The area you self-regulate. They also reach out to us to say they notice the practices that they think are not registered, and so we go into monitor. Now we want to tell the nations when you please look for the QR code that you can scan, and it will tell you the facilities registered and what they can do. And so we say in a farmer, see something, say something, and a farmer will do something. Thank you.
Now that was the wrapped up the question and answer session for this first briefing. And may I respectfully invite the Permanent Secretary, Ministry of Health, the delectable, the admirable, the beautiful princess of Ministry of Health, Dr. Dayo, on the board of health.
Sorry.
Thank you. Thank you very much. I'd like to say a very big thank you to the room. I say thank you to Mr. Governor, both for providing us with an enabling environment so that the health sector can thrive. They are the ones who give us the approvals, they are the ones who give us the nudge, the push to even do better. I'd like to say a very big thank you to the entire health family, starting from the Honorable Commissioner, the SA, members of the body of permanent secretaries, President, everyone is here, and of course to the Commission Chairman, Health Service Commission, and to our Commission members who are in the room. A very big thank you to our directors across the health sector, and particularly our healthcare workers who are working extremely hard at the facilities, both at the tertiary, secondary, and primary. Please give them a round of applause. They are the ones who are driving the work in the health sector. Thank you very much, Ministry of Information, for providing us with the platform, and of course to our personnel. Thank you very much, and we are sure that you give us a good outing. Thank you.
And that will come to the end of this first briefing. May I